When patient decides to undergo IVF, the biggest question in their mind is it painful or is it hurting a lot? Are there any major complications? I would like to assure my patients that IVF is not painful. IVF is a simple procedure in which hormone injections are started from the day 2 or day 3 of the cycle, and they are given for around 10 days. Then when the eggs are prepared, they are aspirated under ultrasound guided transvaginally under anesthesia only in 15 to 20 minutes of time, and it is totally painless procedure. Once the eggs are recruited or they are aspirated, the embryo is formed in the lab, and once the embryo is ready, this embryo is transferred back to the uterus ultrasound guidance. In this, no anesthesia is required. It is like IUI. In IUI, we deposit sperms. In this, we transfer the embryo. Once the embryo is transferred, patient is put on oral and vaginal medications to support the embryo to improve the chances of pregnancy, and the cycle treatment ends. The complications which I have seen in my practice are sometimes ovarian hyperstimulation. That is, when we give injections, the ovaries become very large and more than desired number of eggs are recruited or they are formed. But due to modern management of individualized stimulation protocol, the complication rate is very low. And even if it occurs in certain patients which is unavoidable like PCOS, there are protocols in which the eggs are retrieved and embryos are not transferred back to the uterus, and they are stored or they are frozen. The trigger is modified and the complication of OHS is avoided. Another complication is multiple pregnancy, which can also be controlled by controlling the number of embryos we transfer in the uterine cavity. So when there is a very good quality embryo, we need not transfer too many embryos in the uterus.